Hello, my name is Maya, and for this assignment, I will be presenting a culturally competent counseling approach to support a student's social emotional wellness in a school setting. So, this presentation will include a description of the case study, my selection and justification of counseling theory, and a discussion of whether individual or group counseling is more appropriate, a treatment plan for the student's behavioral and social emotional needs, counselor characteristics and strategies, cultural and ethical considerations, and a mock counseling session demonstrating culturally responsive counseling skills. So I selected the case of Maya, a student navigating immigration-related adjustment difficulties, social isolation, anxiety, and language barriers. So I chose this case because it strongly highlights the importance of cultural responsiveness, empathy, and individualized counseling supports in school. So Maya is a 14-year-old female student who recently moved to the United States from Afghanistan with her family. Her family relocated due to political unrest and safety concerns in their home country. Maya is described as a bright, creative, and motivated student, but she is struggling with transition to a new country, school environment, and with the language. So several important demographic and cultural variables are relevant in this case. And Maya is an adolescent immigrant student, so she is from an Afghan cultural background, and she is entering a school system that may feel a bit unfamiliar and overwhelming to her. So she is also adjusting within the context of displacement and possible trauma exposure related to forced migration. In addition to this, her family is experiencing its own transition stress as they attempt to adjust to a new culture while also maintaining family stability and cultural identity. So, the main concern presented in this case includes social isolation, anxiety, difficulty communicating with her peers due to language barriers, as well as challenges in adapting to a new school environment. And Maya has previously reported feeling alone, disconnected, and nervous about speaking in class. So these concerns really affect her social emotional wellness because they may be contributing to loneliness, reduced confidence, increased stress during an already vulnerable developmental period for her. And this case is especially important from a school psychology perspective because Maya's academic, emotional, and social, as well as cultural experiences are all really interconnected. And supporting her means not only addressing anxiety and peer relationships, but also honoring her identity, her cultural background, as well as her lived experiences. So, next, I selected solution focused counseling as the primary counseling theory. Solution focused counseling is a strength based, goal directed approach that emphasizes a student's existing resources, resilience, and capacity for change. So rather than focusing heavily on pathology or deficits, this approach helps the student identify what is already working and to imagine a preferred future, take small steps, and this will be more achievable steps toward that future that they envision. And I believe this theory is especially appropriate for Maya for several reasons. And the first being that she has already demonstrated resilience. So she has endured a major life transition, entered a new cultural environment, and continues to show motivation to succeed. Second, the solution focused counseling is empowering. So Maya may currently feel overwhelmed and disconnected. So a counseling approach that highlights her strengths and helps her identifying manageable goals is likely to promote help and self-efficacy. And third, this model is practical for the school because it is very efficient, it's collaborative, and adaptable to her needs. And I would compare solution focused counseling with cognitive behavioral therapy or CBT. So, CBT would also be a reasonable choice for Maya because she is experiencing anxiety and negative self perceptions related to speaking and social interactions. CBT could help her examine thoughts such as fear of making mistakes or being judged. However, I still believe that solution focused counseling is a better primary fit in this particular case because Maya's challenges are not only internal cognitive distortions, they are also rooted in a real and significant environmental transition involving her culture, language, belonging, as well as adjustment. And a strength based approach is less likely to unintentionally pathologize her responses to migration stress and more likely to affirm her abilities and resilience, and of course her goals. I also believe I briefly considered the mindfulness based counseling because I believed that mindfulness could help Maya regulate her physiological anxiety symptoms, but mindfulness alone would not provide as much emphasis on her strengths, her social goals, and adaptive problem solving in the school setting. So, for this reason, solution focused counseling is my chosen theory, while mindfulness strategies may be incorporative as supportive tools within the treatment plan. So, next up, for Maya, I would recommend individual counseling as the primary intervention, at least initially. So, individual counseling is the most appropriate starting point because she is facing highly personal and culturally sensitive concerns. She is navigating immigration related stress, language barriers, social anxiety, and possible fears about saying the wrong thing in front of others. And a one on one setting provides privacy, emotional safety, and the opportunity to build trust gradually. And it will allow the counselor, me, to move at Maya's pace and tailor interventions to help comfort level, language needs, and cultural values. So the individual counseling will align with her circumstances because she may not yet feel comfortable disclosing personal struggles in a group setting since she already feels isolated and unsure about peer interactions. And I think that jumping immediately into a group intervention might increase that anxiety rather than induce it. So, that said, once rapport is established and Maya feels more emotionally safe, a culturally supportive group experience could become a valuable secondary intervention. So, for example, participation in a language and cultural exchange club or a newcomer support group could help reduce isolation and normalize her experience as well as build that peer connection. However, I think that the counseling format itself should begin individually. And this approach promotes social emotional wellness because it respects Maya's readiness, provides emotional containment, and helps her build internal confidence before expecting any broader peer participation. Okay, so up next is the treatment plan for the behavioral and social emotional wellness. So, my treatment plan for Maya would focus on reducing anxiety, improving school connectedness, increasing social confidence, and supporting culturally affirming adjustment. So, some presenting concerns could be social isolation, anxiety related to speaking and peer interaction, difficulty adjusting to a new school and culture, language related stress, and reduced sense of belonging. So, the long term counseling goal, I think that over the course of 3 months, Maya will demonstrate improved social emotional adjustment at school by increasing peer connection, participating in culturally supportive school activities, and reporting reduced anxiety in social and academic situations. So, for her first goal, we want to increase social integration. And the first objective would be within 1 month, Maya will attend at least 3 meetings of a culturally supportive or language based school club, such as a language and cultural exchange club. Objective 2 could be by the end of the second month, Maya will initiate at least one conversation with a peer each week in a school setting. And objective 3 would be by the end of 3 months, Maya will identify at least 2 peers or staff members at school who she feels the most comfortable approaching for support. And some interventions that I thought of for goal 1 would be to use the solution-focused questions to identify situations where she has already felt slightly more comfortable or connected. Collaborate with her to identify a school club, peer buddy, or safe social setting aligned with her interests and cultural comfort. Role play brief conversation starters at school-based social interactions, and reinforce small successes and use scaling questions to track comfort with peer interactions. Next up, for goal 2, we want to reduce anxiety related to speaking and school participation. So for objective 1, within 2 weeks, Maya will learn and practice at least 2 coping strategies for anxiety, such as mindful breathing and grounding. So objective 2 will be over the 3 months, Maya's self-related anxiety and school social situations, she will decrease by at least 2 points on a 1 to 10 scale. And objective 3, by the end of the intervention period, Maya will report increased confidence participating in at least one class activity. And some interventions included for goal 2 would be to introduce brief mindfulness-based coping tools as supportive strategies within counseling, use scaling questions to help her monitor anxiety over time, identify exceptions, meaning moments when Maya feels less anxious or more confident, and develop a coping plan for anxiety-provoking situations, such as speaking in class. And for goal 3, we want to strengthen self-efficacy and cultural identity affirmation. Objective 1 will be that Maya will identify at least 3 personal strengths or qualities that have helped her through difficult transitions. Objective 2, Maya will describe at least 2 ways her cultural background is a source of strength, pride, or resilience. And objective 3, Maya will develop 1 short-term personal goal related to school success and belonging. And some interventions for goal 3 will be to use strength-based reflection and affirmations, invite discussion of family values, language, traditions, and protective cultural strengths, frame adaptation as bicultural growth rather than cultural loss, celebrate persistence, courage, and progress. And some progress monitoring for this will be weekly or bi-weekly check-ins, student self-rating scales for anxiety and connectedness, review of participation in club or peer interaction goals, counselor notes on progress towards the treatment objectives, collaboration with teachers and family as appropriate and with consent. So very quickly, for some counseling characteristics and strategies, as the counselor, I would focus on empathy, cultural humility, and building trust, and I would validate Maya's experiences and recognize that her adjustment is complex, not simple. I would remain open and curious about her cultural background rather than making assumptions, and I would use active listening by being patient, checking for understanding, and allowing space for her to express herself, especially with language barriers. And building a strong, supportive relationship is essential so she feels safe and understood. So finally, I would use a strength-based collaborative approach by highlighting her resilience and involving her in goal setting, making counseling something we do together and not to her. And some cultural and ethical considerations real quickly. In this case, it's important to consider Maya's cultural background, immigration experience, and possible acculturation stress. I would be mindful of values related to family, communication, and help seeking, and avoid making any assumptions. So supporting her cultural identity is key, and helping her adjust without losing her sense of self is very important. And ethically, I would ensure informed consent and assent is clearly explained and clearly explaining counseling and confidentiality to them as well. I would also address language needs, use interpreters if necessary, and avoid bias or stereotypes. So to support this, I would communicate clearly, involve her family respectfully, use culturally affirming practices, and collaborate with school staff while protecting her privacy and dignity. Hi Maya, it's nice to see you again. I'm really glad you came in today. And before we start, I just want to remind you that this is a safe space and my role is to support you. So, how have things been going for you at school this week? Yeah, some days are okay, but mostly I still feel nervous. Thank you for sharing that. Starting over in a new country and a new school is a really big adjustment. It makes sense that you would feel nervous. Can you tell me a little bit more about when you feel that the most? When I have to talk in class or when people are already with their friends. Yeah, that sounds really hard, and it can feel lonely when it seems like everyone already knows where they belong. I also want to say that the fact that you keep coming to school and trying, even when it feels hard, tells me that you are very strong. I do try, I just don't always know what to say. Yeah, that makes a lot of sense, especially when you're learning in a new language and adjusting to a new place. I'm wondering, have there been any moments here at school, even small ones, when you feel a little less nervous or a little more comfortable? One girl in class, she had smiled at me and asked me about my drawing for art class. That's great. So, there was a moment when you felt noticed in a positive way. What was different about that moment? Yeah, she was pretty nice, and I didn't really have to say a lot to her. Okay, yeah, that really tells us something helpful, and you may feel more comfortable when the interaction starts gently and when it connects to something you enjoy, like drawing, and that's a real strength. Your creativity may actually help you connect with others. Maybe. Okay, so if we use the scale from 1 to 10, where 1 means I feel very alone and very anxious at school, and 10 means I feel comfortable, connected, and confident, where would you say you are right now? Maybe a 4. A 4, okay. And what makes it a 4 instead of, say, a 2 or a 1? I think there are some teachers who are kind to me, and I really like my art class, especially the art teacher. Okay, yeah, that's such wonderful insight on your teachers, especially. So, even though school is hard right now, there are already some good things that you see, and you found some kind adults, and you found one place where you feel a little more like yourself, and that really matters here. Yeah. Okay, so I want to ask you another question that might feel a little different. Okay, so let's imagine that tonight while you're asleep, something changes, and when you come to school tomorrow, you still have the same background and the same story, but you feel a little more comfortable and connected. What would be the first small sign that tells you things are getting better? I think that I would try to talk more, at least to one person, and I would say hi to someone that is also alone like me. That's a great example. What else might be different? I wouldn't be so scared to speak. Okay, so that makes a lot of sense. Some signs of progress would be saying hi first and talking a little more and feeling less afraid to speak. Those are some realistic and meaningful goals for you. Yeah. I also want to make sure the support we build respects who you are and where you come from. Are there parts of your culture, your language, or even your life before moving here that make you feel strong or comforted? My family and speaking my language at home. That's really beautiful. Your family and your language are important strengths. They are part of who you are, and counseling should support you in keeping those parts of yourself close while you learn how to feel more comfortable here too. Okay. Okay, so one idea we talked about is joining the Language and Cultural Exchange Club. How would you feel about trying that this week just once to see how it feels? Yeah, I think I could try. I think that sounds like a very brave first step, and because anxiety can make these situations feel even harder, I want to teach you a quick strategy. You can use it if your body starts feeling nervous. Would that be okay? Okay. Okay, so let's both put our feet on the ground and notice the ground under your shoes, and I want you to take a slow breath in and a slow breath out. Again, when your mind starts racing, this can help remind your body that you are safe and in this moment. I think that helps a little. I'm glad to hear that. So you should really try this more often when you feel anxious or nervous. And for this week, let's make a small plan together. Your goal should be attending one club meeting. And if it feels okay, either say hi to at least one person or stay long enough to notice one person who seems kind or welcoming. How does that sound? Yeah, I could do that. Okay, great. That sounds like a strong first step. I really appreciate how open you were today. You've already shown resilience, courage, and creativity. And those strengths are going to help you as you continue adjusting, and we'll keep taking this one step at a time together. Okay? Thank you so much. You're so welcome, Maya. And remember, you are not alone here, okay? So let's get started. In conclusion, this case demonstrates the importance of culturally competent counseling in school psychology. Maya's concerns cannot be separated from her cultural background, migration experience, language adjustments, and developmental needs, but by using a culturally responsive, strength-based, and student-centered approach, school psychologists can promote meaningful social emotional wellness while honoring the student's identity. And in this case, solution-focused counseling was the most appropriate primary approach because it emphasizes resilience, hope, and practical steps towards change. And individual counseling was selected to provide privacy, trust, and tailored support. And the treatment plan addressed anxiety, social connectedness, and self-efficacy, while cultural and ethical considerations ensured the counseling process remained respectful, affirming, and professionally sound. Lastly, as a future school psychologist, our goal is not only to help students manage challenges, but to help them feel seen, valued, and empowered within the full context of who they are. Thank you. This was a very long video, but I hope everybody bared with me and everything that I included. Thank you so much.